You brushed your teeth this morning. You probably flossed, maybe used mouthwash. You did everything right. And yet, there's something that doesn't feel quite normal. Maybe a little sensitivity when you drink something cold. Maybe your gums look just slightly different than they did a year ago. Maybe you noticed a tiny bit of blood on your toothbrush and told yourself, "That's normal, right?" Here's the thing nobody tells you. Most people who lose their teeth didn't see it coming. Not really. Because the process doesn't start with pain. It doesn't start with a dentist telling you something is wrong. It starts with small, quiet signs that are incredibly easy to dismiss. Signs that seem so minor that you convince yourself they don't matter. And by the time they do matter, it's already been happening for years. I want to talk to you today about those signs. Not to scare you, but because I genuinely believe that what you're about to hear in the next few minutes could change how you look at your mouth forever. And maybe, just maybe, help you avoid something you really don't want to go through. Let's start with something that almost everyone has experienced and almost everyone ignores: bleeding gums. If your gums bleed when you brush or floss, most people assume they're brushing too hard or that they just need to floss more consistently. And that might be true, but bleeding gums are not normal. Healthy gum tissue doesn't bleed from gentle contact. When your gums bleed, it's usually the first visible signal that inflammation has already started beneath the surface. That inflammation has a name: gingivitis, and it's the earliest stage of gum disease. The reason this matters so much is that gingivitis, at this stage, is completely reversible. But if you keep dismissing that little bit of blood as nothing, it progresses. And what comes next is much harder to reverse. Now here's something that surprises a lot of people: your breath. Chronic bad breath, the kind that comes back even after you brush, even after mouthwash, is one of the most overlooked signs of declining gum health. The bacteria responsible for gum disease produce sulfur compounds as a byproduct. That's what creates that persistent, unpleasant smell that no mint seems to fix. Most people in this situation spend years buying stronger and stronger mouthwashes, thinking it's a hygiene problem. It's not. It's a bacterial problem, and it's happening below the gum line, in places your toothbrush simply can't reach. Pay attention to this next one, because it's subtle, and most people only notice it when they look at old photos of themselves. Receding gums. Your gums are supposed to hug your teeth tightly, like a collar. When they start to pull back, even just a millimeter, it exposes the root of the tooth. That root was never designed to be exposed to food, temperature, or bacteria. This is why receding gums cause that sharp sensitivity when you eat something sweet or drink something cold. And here's the part that's hard to hear. Once your gum tissue recedes, it doesn't grow back on its own. The damage is permanent unless treated. But the earlier you catch it, the more options you have. There's another sign I want to mention, one that people almost never connect to their gums: loose teeth, or teeth that feel like they've shifted slightly. If you're in your 30s, 40s, or 50s, and you notice that a tooth feels even slightly different than it used to, less stable, or like your bite has changed, that is your body telling you that the bone and tissue holding that tooth in place may already be compromised. This is advanced gum disease territory, and I say this not to alarm you, but because this is the stage where people look back and wish they had paid attention to the earlier signs. Now, and I want to be very clear here, I'm not a dentist. Nothing I'm saying is medical advice. If you're experiencing any of these signs, the most important thing you can do is see a professional. But I also know that a lot of people watching this are looking for something they can do right now, today, while they wait for that appointment, or in between visits, or simply as part of taking better care of themselves daily. And honestly, that search led me to something worth mentioning. There's a supplement called ProDentim that I came across. And before you roll your eyes at the word supplement, hear me out for just a second. It's not a replacement for brushing or going to the dentist, but it was specifically formulated to support the oral microbiome, the balance of good and bad bacteria in your mouth. Because here's something fascinating that most people don't know. Your mouth has an ecosystem, and most conventional oral care products, especially antibacterial mouthwashes, actually kill the good bacteria along with the bad, which over time can make things worse. ProDentim works differently by introducing beneficial bacteria to help restore that balance. Is it A miracle? No. But if you're already doing everything right and still struggling, it might be worth looking into. The link is in the comments if you're curious. Anyway, back to what really matters here. Because there's one more sign I haven't talked about yet. And it might be the most important one of all. Pus, or swelling around a specific tooth or area of your gum. If you've ever noticed a small bump on your gum that seems to come and go, or any kind of discharge when you press on an area, that is a dental abscess or an active infection. This is not something to wait on. This is the kind of thing that, left untreated, can spread. People have been hospitalized from dental infections that started exactly like this. If this is you, please, book that appointment this week. Now let me pull this all together, because I think the real message here is something deeper than a list of symptoms. We live in a world where we're taught to react to health problems, not prevent them. We wait until there's pain. We wait until there's a diagnosis. We wait until something forces us to pay attention. And with oral health specifically, that approach is incredibly costly. Financially, physically, and emotionally. Dental procedures are expensive. Tooth loss affects confidence in ways that touch every single part of your life. And the anxiety of sitting in that chair knowing things have gotten serious, it's avoidable. The people who keep their teeth healthy into their 60s, 70s, and beyond are not the people with perfect genetics. They're the people who paid attention early, who didn't dismiss the small things, who understood that their mouth is connected to the rest of their body, and that gum disease has been linked in research to heart disease, diabetes, and cognitive decline. Your mouth is not separate from your health. It is your health. So if any of what I described today sounded familiar, the bleeding, the sensitivity, the bad breath, the slight shift in how your teeth feel, take it seriously. Not with panic, just with attention. Because attention, right now, is the cheapest and most powerful thing you have. And if you want to keep learning about this, because there's a lot more to this topic than one video can cover, make sure you subscribe. The next video goes into something most dentists don't explain to their patients. Why some people's gums decline fast even when they brush twice a day, and what's actually happening beneath the surface. Take care of yourself. Your future self will thank you.